name is Tracy Cundiff. I'm a 5th semester nursing student, and today I will be performing a male Foley catheterization for a patient. So before I go and get my equipment, what I want to do is go in and assess my patient. I want to know what their level of consciousness is, if they have any drug allergies, especially to latex or iodine. I want to know when they last voided, and I also need to assess what catheter size they need.
And then going to put my
then I would go and gather my equipment. So what I need is, I would get Clorox wipes to wipe off my table, to set my supplies down. I need a sterile folded catheter kit, pericare wipes, a bath blanket, which I won't be using so that you can see the procedure, but typically I would drape them with a bath blanket for their own comfort and privacy. Clean gloves, as well as well-fitting sterile gloves. I would come back into my patient's room. I'm going to introduce myself if I haven't done so. So my name is Tracy. I would ask them what their name and date of birth is and check that against their ID bracelet. I would go ahead and provide privacy for the patient. I'm going to go ahead and explain the procedure to them. I'm going to wash my hands.
So this away above waist level.
And raise the bed to a working height. I'm going to go ahead and put on some clean gloves and perform pericare for them. So I'm going to cover my patient.
You're not allowed to.
And I'm going to make sure that they're in the supine position with good alignment. And I'm going to go ahead and, if they can't do it themselves, I would want their knees bent with their feet flat on the bed. Would drape them with a bath blanket when appropriate. And then I would take my pericare wipes and I'm going to clean their area from dirtiest to cleanest. And then I would throw this away, take off my gloves. I'm going to wash my hands again. Wash my hands. I'm going to go ahead and get rid of my bath blanket, so I'm going to go ahead and wash my hands again one more time, just to be sure. And then I'm going to go ahead and open my Foley catheter kit. So I'm going to open it farthest away from me first, only touching the outside flange perimeter. I'm going to go ahead and take my sterile gloves out. Now, inside the kit there's usually a triangle drape that you can drape over their penis. I don't use that. I would take that and remove it. I want to take the drape that goes underneath their buttocks and only touch the outside 1 inch perimeter, and the shiny side goes down. I would ask the patient to lift their buttocks up if they could for me. If they can, I would have somebody assist me to do that. And I'm just going to drape this underneath their bottom to protect their sheets and keep a sterile field. I would then take my catheter kit, grab my sterile gloves out. I'm going to open these up, only touching the 1 inch outside perimeter. These are turned around backwards. Open them up. Put the non-dominant hand on first. These are backwards in the package, but non-dominant hand on first. And then the dominant hand. And I would take this and throw it away above waist level. So I'm going to go ahead and set up my supplies before I get started. So I'm going to go ahead and attach my saline syringe to the port so I can inflate the balloon when I'm ready. Set up my sterile lubricant. And then there would be a package of iodine in here that I would use to saturate the cotton balls that are in the kit. We're just going to pretend for this. Once everything on my table is ready, I'm going to contaminate my non-dominant hand. So I'm going to grab the patient's penis and lift upward taking a cotton swab, and I will clean. If they had foreskin, I'd want to pull that back and clean around the meatus. This gentleman is circumcised, so I'm just going to clean the urinary meatus and then the outside of the penis. So I would clean round it over the urinary meatus. I would throw that away and get a new one. Clean down the shaft around the head, and I would throw that away and get a new one. And then clean again around the meatus, making sure that it's thoroughly sterile. Throw that away, and I would set my forceps down. So now that he is sterile, I'm going to go ahead and take my clean hand, and I would lubricate the catheter tip. Take the sheath off if there is a plastic sheet on the catheter. I'm going to lubricate this up to 6 inches, which I can't fit all of that in the bottle there, but I would lubricate this up to 6 inches. I'm going to wrap this catheter around my hand and pull the entire catheter down into the bed, making sure that my the catheter itself stays sterile. So when I'm ready to insert this catheter for him, I'm going to have him take a deep breath in and out and let him know I'm getting ready to insert it. I would insert the catheter tip 7 to 9 inches for males until I see urine return, and then another 2 inches to ensure that I'm inside the bladder. And then I will take my sterile hand. I'm going to inflate his balloon and then take off the syringe. And I would tug on this to make sure that it's secure and it's in the right spot. At this point, I can release my hand. I'm going to take off my sterile gloves and throw them away. I would wash my hands again. I'm going to go grab a set of clean gloves. Excuse me. So I would grab another set of clean gloves. And I'm going to go ahead and secure this catheter to the patient's leg using a catheter securing device or just tape. So I would secure this to his leg, making sure that the ports are accessible. And then once that is secured, I'm going to take this catheter bag and place this on an immovable part of the bed, making sure that there are no kinks in the tubing, that he has good urine flow down into the bag. I'll take his drape out and throw that away. And then I will cover him back up, and I'm going to lower his bed back down. Make sure that his call light's in reach. And then once I'm done, I'm going to go out and document the date, the time, the size of the catheter used, how well he tolerated the procedure, and then I also want to document the urine color, if there was any urine odor, blood in the urine, or any turbidity, so it was cloudy, clear, and that's it.